question that is out there is that what is a risk stratification score and what does it mean for treatment? And I believe this might be directed again at Dr. Sri Suvananukon, who did allude to risk stratification in his presentation. Again, the caveat is that there is no disease mentioned in the question. So, Dr. Sri Suvananukon, to just help wrap up this Q&A session, do you want to just briefly talk about risk stratification and implication on treatment?
Sure, sure. This is a very generic answer, but stratification just means put into categories or put into buckets. And risk is highly contextual. So for each disease, the risk could be risk for blood clots, which is helpful for me in polycythemia, risk for progression to acute leukemia, which is helpful for me in um, myelofibrosis. We can also think about risk for relapse for after a transplant, which is helpful in leukemia. So risk is really contextual. And across all these diseases, what we typically do is make a system to say, what risk do we really care about? And how do we make a system that categorizes who's higher or lower for that outcome of interest? And does a treatment modify that risk? That's the general paradigm for a lot of these diseases, but not necessary for a lot of these diseases.
Great, thank you. And with that, panelists, thank you so much for your time today on a Saturday to spend some time with patients and caregivers here and help answer a lot of these great questions that really came in. I'm very grateful for all of you for taking the time off and for Grace to really hold this Blood Cancers Onc Talk twice a year, which I've been very grateful to be a part of as a speaker and now as a moderator. And, a huge thank you to our sponsor organizations for their support of this particular program, which is Janssen, Lilly Oncology, Merck, and AbbVie for the continued support. And thank you so much to everyone for listening. You will have a version of these in as an enduring material in the form of short recorded talks on the Grace website. So if you feel like you want to listen to these experts talk again, please feel free to visit the Grace website. Thank you all and have a good day.